There are more than 1,600 active COVID cases in Victoria and the outbreak is showing no signs of slowing. We're still waiting on today's number to come through. It usually comes through about this time. Raph Epstein is a radio presenter in Melbourne and he's usually got a pretty good handle on what the figure is. He tweeted earlier on that it was around the 250 mark again, and that's yesterday it came in at 246. The state is racing to reach 70% first dose vaccinations and looks on track to reach that point earlier than expected. Just over 60% of the eligible population has had one dose, while more than 37% of Victorians are fully vaccinated. Reporter Steph Ferrier joins us now from Melbourne. Steph, g'day. I notice you've got the phone there in hand, flicking through it to see if there's been a refresh on that Victorian Government Department of Health website with those figures today, but yeah, not through just yet.
Good morning, Joe. No, still madly checking to see what the Victorian Government's Health Department says here, but at this stage we're just still waiting. As you mentioned, Raph Epstein from ABC Radio Melbourne, the Drive host here, had mentioned just under 250, so that's going to keep it basically on par with what we had yesterday, which was 246 new cases, just 121 of those linked as well. So obviously, at least potentially we're staying steady at the moment with those figures.
Now, as we wait for them to come through, tell us where the vaccination process is there in Victoria.
Yes, so from this morning we're going to have another cohort that will get priority access. That is our 50,000 Year 12 students who will be able to get fast-tracked through the system. That is really important because it means that they'll be able to at least have one of the first Pfizer shots in their arms before they have their all-important general achievement test on October the 5th. That was postponed. And then, of course, their exams after that. From this morning as well, the Year 11s that are doing some of those Year 12 subjects, they'll be able to make phone bookings. These are all booked slots, so you can't just turn up as a Year 12 student, but they have been assured that every single student will have one of those doses that has been set aside for them so that they can get them through the system. And it's not just the students, it's also a whole range of other people. From this morning, we're seeing, for example, the Islamic Centre in Newport in Melbourne's West and other mosques opening up to become vaccination centres, so really taking it to the people. We've got Jabba the Vax bus, which is an interesting name for the vaccination bus up in Shepparton, that is going out and about to those people who might not be able to make it to some of those centres. And as a result of that, we are hopeful that in this race to vaccinate people up to that 70% threshold of the adult population or those aged over 16, that we will be able to actually get there a little earlier than the originally earmarked date, which was September the 23rd. It's now back down to around about September the 19th or so, and we're certainly hoping to see that number creep down as we see some more of those Pfizer doses become available for some of the younger cohorts that need Pfizer and only Pfizer here as well. As you mentioned earlier on, we're about 60.8% of the adult population that is fully vaxxed and 60.8% who've had their first dose and 37.8% that have had the full vaccination. So we are slowly inching there, but obviously the government constantly is saying that supply is the real key to that.
And Steph, New South Wales, the ACT and Victoria obviously still in the grips of these outbreaks at the moment. But is there some optimism there, growing optimism, and there are still people sick, but is there some optimism there in Victoria that you can start to see the end of this, in some kind of fashion, the end of this coming?
Well, we certainly hope so. When we were told about some of those easing of restrictions that we would get once we got to that 70%, a couple of those things were simply an extra hour of exercise from 2 to 3 hours, and also being able to double the travel from home limit from 5 kilometres to 10 kilometres. So a lot of people were saying, oh goodness, we'd hope to be able to get some more. And the Premier, Daniel Andrews, has hinted that there will be some more easing of restrictions, particularly for people who are fully vaccinated as well. Another glimmer of hope as well is for those people in the regions, because we've heard once again that they should be able to see some sort of eased restrictions at some stage being announced this week. So that is great news for people that are living outside the metropolitan zone and also outside, of course, the zone of Shepparton and surrounds, which have been affected by this outbreak as well. So I guess we're just all really trying to get those vaccination levels up at the moment, because clearly we are staying steady potentially with these numbers. We're not going up dramatically, but we're not coming down dramatically either. So really the only path out of this is to be able to vaccinate our way out and to get to those 80% thresholds, which is when we're going to have much more significant easing of restrictions as well. But it's been a very long time. We're now 1 month and 1 day into this lockdown 6, and it has been cumulatively, sorry for the very loud bus noise behind me, but it's been cumulatively just so many days over here. So you can understand why Victorians are just really wanting to get to the end of this as quickly as possible.
Okay, Steph Ferry reporting there from Melbourne. Now let's go to our New South Wales reporters. We've got Gary John Lysart in Dubbo in the central west of New South Wales and Lara Himes in Sydney. Gary, to you first. What can you tell us about the active cases in Dubbo?
Yeah, g'day Joe. So across Western New South Wales, which includes here in Dubbo, and as well as other communities like Orange and Bathurst, and even as far out as Burke and Warren, there's been about 800 cases of COVID-19 detected across that Western New South Wales region. Now, that doesn't include the communities of Wilcannia and Broken Hill. They're part of the far western local health district, and there's been about 115 to 120 cases of COVID-19 detected there. Now here in Dubbo specifically, there's been around 600 or so cases of community transmission since we had that first case detected. Now that represents about 1% of the total population of this regional city, so a really big chunk of population now. Now, the second biggest, epicentre of COVID-19 in Western New South Wales is actually in the Berkshire, which is really far west of here. There's been about 80 cases there, and quite a few of them are in a small Aboriginal community called Angonia to the north of Burke. And Angonia is the hometown of an Aboriginal woman in her 70s who passed away in Dubbo Base Hospital yesterday with COVID-19. She became the second fatality of Western New South Wales as part of this most recent outbreak. And Joe, it's going to be something that's felt across Western New South Wales. Aboriginal people have very large family networks. So while this woman may have lived in Angonia, certainly there'll be people in Brewarrina, Dubbo, even as far out as Broken Hill that will be feeling this as well.
And Gary, there's a curfew in those local government areas of concern in Sydney, I think about 12 of them. What's the discussion around a curfew in regional areas?
Yeah, Joe, the Deputy Premier, John Barilaro, has been very staunch in his belief that regional New South Wales, Western New South Wales in particular, doesn't need a curfew or any other extra restrictions imposed. He thinks that the restrictions imposed currently are enough to help stem the rise of COVID cases, and health authorities here have been very buoyed by the fact that there hasn't been that massive surge in COVID cases that they were expecting. Regional New South Wales, the lockdown in regional New South Wales is due to end soon, and the Deputy Premier says that there will be some parts of regional New South Wales that will come out of lockdown when that due lockdown date is to end. But he has also conceded that Dubbo in particular and some other parts will be on the same trajectory for restrictions being eased as Sydney and those 12 local government areas of concern that you mentioned, and that's due to be sometime in October, Joe.
Yeah, okay, now let's go to Lara Himes in Sydney. Lara, that modelling was released yesterday predicting what the next month or two might look like in Sydney. Take us through what that said.
Well, that long-awaited modelling was based off the Burnett modelling as opposed to other models that had been circulating by other experts in the community. We know with that was released yesterday, there were still quite a few variables in it, and we don't know if some situations had been included in determining the trajectory of the virus. So one of those things could be whether or not social distancing was still going to be observed, whether or not the easing of restrictions was coming into it. We also know that the data that had been obtained was based on 12 local government areas of concern, and it was also the worst case scenario. We also we weren't able to ascertain what the predicted number of deaths was going to be for this period. And also the data that was used within this was actually being taken from the end of August. So we know that since that time there has been an increase in COVID cases and similarly with hospitalisations. Although all those things had come into play, it still does pose or still presents a good framework going forward to get a little bit of an insight about the pressures it's going to place on the New South Wales health system. Also, in the stats obtained yesterday, we know that about 1,000 or so beds would be taken up during the peak hospitalisation periods, and just over half of those cases would be in relation to COVID. New South Wales Health has told us about 2 weeks ago or so that they've got the capacity for 2,000 beds. So they say that even though the system is going to be stretched, it is going to be able to cope. What we did obtain, though, is what the Premier had been saying all along, is that COVID cases, the number of cases, are likely to peak by about mid to the end of September, and the hospitalisations, which do have a lagging effect from when COVID is diagnosed, is probably going to peak at around mid-October.
And what's happening with the share of vaccine spread around the nation?
Well, this was a story that was looked at exclusively last night from the 7:30 team. It was looking at the way that the Pfizer vaccine was distributed across the states and territories. Now, around June, Sydney and New South Wales received about 32% of their allocation of Pfizer vaccine. Last month, they had to look through the data that was publicly available, and it seems that Sydney had actually peaked in their accepting of Pfizer vaccine, and that was around 45%. So that is going above the per capita arrangement that the government had been spruiking. They had been saying that Pfizer vaccine was equitable and was going to be distributed equally throughout the states and territories. And similarly, that was the way that the media were reporting it. Because of that extra allocation of Pfizer vaccine, it meant that other states were missing out. Victoria and Queensland likely to be the states that suffered because of that move, but it does pose many questions for the federal government as to what the plans are going to be for additional Pfizer doses.
OK, we'll leave it there. Lara Holmes in Sydney and Gary John Lysart in Dubbo in the central west of New South Wales. And we're expecting that New South Wales media conference at the regular time of 11 o'clock this morning with a COVID update. ACT's locked in for 11:45, that's Eastern time. And we haven't got a time for Victoria just yet, but it generally happens in that 11 o'clock hour. We'll be across that here on the ABC News channel and bring them to you live in some fashion on some ABC platform. I'll talk you through them during the day. Now, at-home rapid tests could become a feature of Australia's defences against coronavirus, with the Health Minister hopeful the regulator, the TGA, approves them for use soon. Whether states and territories are prepared to use them widely is yet to be seen. Political reporter Matthew Doran joins us now from Parliament House in Canberra. Matt, g'day. So explain what these rapid tests are.
Well, they're quite common overseas, Joe, but their use in Australia has been fairly limited so far. It allows people to test themselves for coronavirus in the comfort of their own home, with the results coming back in some cases within just 10 minutes. It's a vastly different proposition to the standard PCR tests that we have seen right across the country, forming the basis for that monitoring and surveillance program that state and territory health agencies have put in place to try to figure out where coronavirus outbreaks are popping up and try to monitor how they are developing. And there has been a bit of a reluctance to use these at-home tests in the past because, first of all, they're not as accurate as the standard coronavirus tests. And also, there's been a debate about, well, if someone's taking one of these tests at home, who's actually monitoring the results? They're not being fed back to state health departments or territory health departments. They are just being used by the individual, potentially sharing that information with with their employer, but it's not actually going any further. However, as we start to move into the next stages of dealing with this pandemic and as coronavirus restrictions ease in line with vaccination levels increasing right across the country, there is this debate about their use more broadly across the country, and the Health Minister Greg Hunt is hopeful that the TGA, the regulator in this instance, will approve the use of these at-home tests in the very near future. But whether or not state and territories are going to be willing to use them is another situation. The AMA has noted that in a state like New South Wales, where there are more than 1,000 cases being reported of new coronavirus infections each and every day. If one of these at-home tests is used and it says that someone is negative when they have actually been infected by coronavirus, if one slips through, it's not really going to make much of a difference in the grand scheme of things. However, in a state such as South Australia or WA, where there are no coronavirus cases, there might be more of a reluctance to do so, because if someone does slip through the cracks and gets out there into the community, it could really sound the alarm bells for state health authorities.
I mean, I think Mr Morrison has exercised poor judgment in this case. I was a bit surprised when I read he had done this, to be honest. It's not that he doesn't deserve to see his kids, but so does every other Australian. And I think that when your people are doing it tough, you've got to do it tough too. I know that for a lot of MPs, when we leave Canberra, we've got to spend 2 weeks locked down away from our families. So I just don't know how he was able to get a permit when most people can't.
That's actually Bill Shorten talking about another issue which is dominating discussion here in Canberra, and that is the decision by the Prime Minister to duck home over the weekend after Parliament finished for Father's Day, returning to Sydney from Canberra and then coming back to the capital yesterday morning. There is, of course, this discussion as to whether or not that was appropriate because of the circumstances surrounding lockdowns in the ACT and Sydney. The Prime Minister's office insisting that the Prime Minister has abided by the rules, that he did have an exemption from ACT Health to make that trip. However, he might be receiving criticism now, saying that he had to return to Canberra to take part in the first day of the National Women's Safety Summit, which was yesterday, as well as a National Security Committee meeting of Cabinet. There is, of course, a debate as to whether or not the Prime Minister should be allowed to travel a bit more freely than the standard member of the public, considering his role, or whoever actually occupies that office, considering that it is a pretty unique job and that they do need to have a bit of flexibility in what they are doing. However, at a time when we've seen pictures such as those coming out of Queensland with families meeting on either side of the Queensland-New South Wales border, haven't been able to actually meet before then, but celebrating Father's Day together, those many stories we've heard about people being blocked from entering other states, this discussion as to whether or not it's appropriate or not is, of course, bubbling away. The ACT Health Minister, Rachel Stephen-Smith, was speaking to ABC Radio Canberra earlier this morning. She was reluctant to go into the particulars of the Prime Minister's case, but she did provide an insight into how ACT Health deals with federal politicians of all political persuasions coming in and out of the capital.
Federal MPs and parliamentarians are considered to be essential workers, and there's a process in place that's been worked out between the Chief Health Officer and the Commonwealth Chief Medical Officer about what the expectations are of federal politicians in relation to that, and then it's up to them, I think, to make a decision about whether their decisions are appropriate or not.
Rachel Stephen-Smith speaking to the ABC earlier today, and that's the kicker there, Joe, that issue of what is appropriate or not, as the Minister outlined in that instance. I don't think there'd be many people across the country who would begrudge the Prime Minister wanting to head home and see his family, but when so many others are in the position where they can't, this discussion about the rules applying equally certainly comes to the fore. Joe?
Okay, Matthew Doran there in Canberra.